February is Heart Health Month, and staying heart healthy isn't just important for people. It matters for our pets, too. So joining us today are veterinary experts, Dr. Ashlie Saffire and Dr. Sarah Clay Bell, to share what cat owners need to know about feline heart health and how early detection can really make a life-changing difference. How are you both today?
Great.
We're
Thanks
good.
for having us.
Thank you.
Great to catch up with you. So happy you're sharing this important message. And why is it so important to talk about heart health when it comes to cats?
Well, just like people, cats can also get heart disease, and they don't always have obvious clinical signs. In fact, cats are really good at hiding illness, and sometimes their signs are so vague it can be very easily missed. And then on top of that, cats tend to visit the veterinary clinic for routine checkups far less than dogs. So awareness is really important because with early detection and new treatment options available, we can do something for cats and help their hearts stay strong for years to come.
So what is feline hypertrophic cardiomyopathy? It's also known as HCM. That's a much easier way to say it. What is it exactly? How does it affect cats?
HCM is the most common heart condition that we see in cats. It leads to a thickening of the heart muscle, which makes it difficult for the heart to relax appropriately to fill with blood and pump blood out to the rest of the body. It affects about 1 in 7 cats, but the hard thing is most of them show no signs or symptoms until it can be advanced. And then they can be at risk for congestive heart failure, clot formation, abnormal heart rhythms, or even sudden death.
Okay, so you're saying there are very few signs. Is there anything that a pet parent can look for or notice to see if their cat might be developing HCM?
Well, that's the hard part. Unlike dogs, cats don't cough, or when their heart is in trouble, they really don't have obvious signs. And so it's really important that a cat is examined by a veterinarian where they can listen to their heart and lungs and detect signs of heart disease like a heart murmur or an arrhythmia so that we can detect heart disease early and catch it early.
Are there some cats that are more at risk than others? I mean, I would think, cats that have extra weight on them would be more at risk, but I mean, are there certain breeds?
Yeah, that's a good point. So there are a couple of breeds of cats, primarily Maine Coons and Ragdolls, that have a genetic predisposition, but any cat can be at risk for this disease, underscoring the importance of screening.
I'm sure. What else can cat owners do to help protect their cats' hearts in general?
Great question, and I can't drive this point home enough. Annual routine veterinary exams are so incredibly important to allow a vet to listen to the heart and lungs, listen for signs of a murmur, and if they do detect any of these risk factors, they might recommend some additional testing like imaging, an x-ray, or an echocardiogram, or some screening lab work, or perhaps a blood pressure screen to help identify these signs and diagnose heart disease. The good news is there is a new treatment option available called Feline CA1, which is a great way to manage HCM before symptoms develop. And the cool thing is the active ingredient sirolimus is a delayed release tablet, which makes really easy on cat owners to medicate just once weekly.
Where can we go for more information to find out more and keep our pets healthy?
Yeah, your viewers can visit heartstrongfamilies.com for more information about feline hypertrophic cardiomyopathy and Feline CA1. Visiting the primary veterinarian is the best resource to get their cat screened. And then also sharing awareness on social media using the hashtag Heartstrong.
Wonderful. Thank you so much for your information. Appreciate it.
Thank you.
Thanks for having us.